Hello everyone, my name is Sophie and I am a heart failure coordinator with Memorial Healthcare System. And today we're going to be talking about heart failure. You may be wondering, what is heart failure? Well, 6.5 million Americans suffer from heart failure. A normal healthy heart pumps oxygen-rich blood to the rest of your organs in your body. With heart failure, your heart isn't able to pump effectively, causing blood to back up into your lungs and other parts of your body, causing various symptoms. There are two main types of heart failure. The first type of heart failure is heart failure with reduced ejection fraction, or reduced EF. You may be wondering, what is ejection fraction? Ejection fraction is the estimate of how strong your heart is pumping. The normal is above 50%. So with heart failure with reduced ejection fraction, the patient's or your ejection fraction is less than 50%. The next type of heart failure is heart failure with preserved ejection fraction. This is when the heart becomes stiffened and isn't able to pump effectively. So two types of heart failure with reduced ejection fraction, where it becomes weakened, and heart failure with preserved ejection fraction, where your heart becomes stiff. Some people have both. Now you may be wondering, how can they tell what your ejection fraction is? They can do an ultrasound of your heart to see what your ejection fraction is. So next time you go to your doctor's office, I want you to ask, what is my ejection fraction or my EF? And remember, normal is above 50. Now we're going to be talking about some of the symptoms of heart failure. Some patients have one, some patients have more than one. Patients may have shortness of breath. This could be while you're sitting, walking, or even laying down. The most common symptom is fatigue, feeling tired all the time. Some patients will have swelling. This will be in your belly, your ankles, or your feet. You might notice that your pants aren't fitting well anymore, or your shoes are getting too tight. Another symptom is weight gain. This may be rapid weight gain, 2 to 3 pounds overnight or 5 pounds in a week. Rapid weight gain. Some patients complain of palpitations or irregular heart rhythms. Some patients might have a frequent cough or wheezing. Some people think they might have a cold when in fact it may just be fluid overload. Some people might have nausea or decreased appetite. You may feel like you make a plate of food and you aren't able to finish it all, even though you are gaining weight. Some people might have some mental confusion or they feel a little foggy. Here at Memorial, we have a team of heart failure specialists to help you. There are heart failure cardiologists, you have your community cardiologists, we have social workers, we have nurses, nurse practitioners that all specialize in heart failure. Now we're going to be talking about medications. These are common medications that are given to heart failure patients. These would be diuretics, ACE inhibitors, ARBs, beta blockers, aldosterone blockers, Entresto, digoxin, and Corlinor. First, let's talk about some diuretics. Diuretics help decrease fluid overload. They get rid of excess fluid. This would be your Lasix, your aldactone, Bumex, spironolactone. We also have diuretics that are aldosterone blocking diuretics, and these get rid of excess fluid, save potassium, and delays the progression of heart failure. This would be your spironolactone or your Inspira. Other medications that we have are ACE inhibitors or ARBs. ACE inhibitors would be your lisinopril, ramipril, and enalapril. And then your ARBs would be your losartan, valsartan, candesartan. And then we also have Entresto. These medications strengthen and improve your heart function, the muscle of your heart. There are also beta blockers. These help strengthen your heart muscle, and they also increase life expectancy. Who doesn't want that? And then we have your digoxin, which increases the force of contraction of your heart muscle, strengthens your heart muscle, and controls irregular heart rhythms. And then lastly, we have Corlinor that decreases your heart rate. So you may see these medications at home, and you might notice on the bottle it will say for blood pressure. But in fact, these medications also help in other ways, which is why it's very important to make sure you take your medications. So I want you to make sure that you always take your medications. So here are some helpful tips. You can put an app on your phone. You can set a reminder in your calendar. A pill box is very good as well, because you can know if you took your medications or not. Some patients like to put sticky notes around their house to remind themselves. You can have your friends or your family remind you, or you can even tie them to an activity of daily living, such as eating. If you have to take your medication twice a day, take them with breakfast or dinner. Or if you have to take them 3 times a day, you can take them with breakfast, lunch, or dinner. You want to make sure that you don't take any medication unless your doctor says it's okay. Even simple things like herbal supplements or even over-the-counter pain medication need to be approved by your doctor. Other medications can interact with the medications you are taking, or cause side effects, such as NSAIDs, which are people take for pain, such as Motrin, Aleve, Advil. These medications can cause water retention and increase your blood pressure. So please make sure that you ask your doctor if it's okay if you take any of these medications. Now we're going to talk about sodium restriction, diet. One of the things that people have the hardest time with. Sodium causes fluid retention and can cause your body to retain fluid, causing various symptoms. So the recommended dose is 2,000 milligrams or 2 grams a day. 1 teaspoon of salt is more than 2,000 milligrams. So a little bit of salt is really a lot. So it's important that you make sure you read all your labels. You want to stop adding salt to your diet. No salt in your food, get rid of the salt, throw it away. Even kosher salt, pink salt, Himalayan salt. Any of those salts, do not use, just get rid of them. You can use other things such as herbs and spices to flavor your food instead. Stay away from all convenience foods. No fast food, no frozen dinners, no canned food. Try to always eat fresh, unsalted foods. And here's an example. 1 cup of canned green beans is 320 milligrams of sodium. 1 cup of fresh green beans is only 5. Another example would be of your minute rice, the rice that you place in the microwave. Half a cup is 570 milligrams of sodium, opposed to a half a cup of regular cooked rice is only 1 milligram of sodium. And these are examples of why you should always read your labels. And here's a label that you can look at for an example. Always look at what the sodium content is. Be careful because this is actually per serving. So you want to make sure you look at the serving size and how many servings are in each container. For example, this product has 440 milligrams of sodium per serving. If you were to decide to have the whole container, that's over 1,800 milligrams of sodium a day. So always look at your serving size and how much is in each serving. With heart failure, you may be thirsty. All these medications that you're on can cause thirst, but it's important that you make sure you don't drink more than your doctor recommends. Usually, the doctor will tell you to have no more than 8 cups of fluid a day. Now, you want to take into consideration all liquids. So this would be your ice, jello, pudding, ice cream, yogurt, coffee, milk, tea. All these are considered liquid. So you want to add them up when your doctor tells you a restriction. So next time you go to the doctors, you're going to ask, how much fluid should I be drinking? Here are some ways that can help quench your thirst. You can suck on a piece of candy, you can chew some gum, eat some frozen grapes, suck on a popsicle, remember that is fluid, and you can sip on some cold water. Now we're going to talk about cardiac rehab. Your heart is a muscle, so you want to make sure you stay active, and cardiac rehab is a way to help. Why you should stay active: it helps manage your weight, increases strength, helps reduce stress, lowers your blood pressure, and improves your overall quality of life. In cardiac rehab, you will exercise with a monitor on, and they can see how well your heart does with your exercise. Smoking. You want to make sure you stop. There are 5 ways to help quit smoking. You want to get ready, get support, learn new behaviors or skills, get medication and make sure you take it correctly, and be prepared for relapse and difficult situations. There are programs to help quit. You can always ask your nurse and she could help give you the information. Now, this is a log that we're going to give you that you're going to track your blood pressure and your weight every day. Now remember, I told you a symptom of heart failure is weight gain. You want to make sure you don't gain weight rapidly. 2 to 3 pounds overnight is rapid weight gain and is usually due to fluid, not due to a big meal the day before. So every morning I want you to get up, go on the scale, weigh yourself at the same time wearing the same clothing, and you're also going to check your blood pressure. If you notice you gain 2 to 3 pounds overnight, you're going to go ahead and call your doctor. Or if you gained 5 pounds in 1 week. Some patients will notice they just gain 1 pound a day. They gain 1 pound, 1 pound, 1 pound, 1 pound, 1 pound, and in 5 days, that's 5 pounds of fluid. So you always want to make sure what your normal weight is, and if you notice 2 to 3 pounds overnight, you're going to go ahead and call your doctor. Or 5 pounds in 1 week. Here's a little heart failure awareness action plan. This is a very good tool to keep on your fridge. We also have magnets that you can put on your fridge as well. It's a little stoplight, green, yellow, and red. Green is where you want to be, yellow you call your doctor, and red you're going to come to the hospital. So green, you're not going to have any shortness of breath, no swelling in your ankles, feet, or stomach, no weight gain, no chest pain, and no changes in usual activity. You're gonna make sure you weigh yourself every day, take your medications, go to your doctors, and eat a low-salt diet. If you notice anything in the yellow, you're gonna go ahead and call your cardiologist. The goal is to call sooner than later. So 2 to 3 pounds overnight, you're gonna call your doctor, or 3 to 5 pounds in 1 week. If you notice that you have to start using more pillows at night, you're also gonna call. So if you normally use 1 pillow at night and you notice you have to use 2 or 3, you're gonna go ahead and call your doctor. Also, if you notice increased swelling or coughing, increased shortness of breath upon normal activity, or you need your medications to be changed. Some heart failure patients normally have shortness of breath, but you want to make sure if it's above your normal, you make your doctor aware. And if you notice you don't like your medication for some reason, such as you don't like a side effect or your insurance doesn't cover it, please make your doctor aware. They can always change this medication. And red, this is the danger zone. For this, you're going to come to the hospital. If you gain more than 5 pounds in 1 week, or if you notice you're waking up at night with severe shortness of breath, if you're having dizziness or falling, or if you're having shortness of breath at rest with chest tightness or wheezing, you're gonna go ahead and call 911 or seek your nearest emergency room. Here's some encouragement. You got this. You're gonna make sure you follow up with your doctor within 7 days. You're gonna monitor your symptoms and call sooner than later. Take your medications every day, weigh yourself and check your blood pressure every day, and you're gonna start some cardiac rehab. And always remember what zone you're in. Think to yourself, what zone are you in right now? We also have a support group called Mended Hearts. This is a support group that meets monthly at Memorial Hospital West and Memorial Hospital Regional. This support group is made up of peers, patients who have heart failure or other cardiac issues. They've gone through things just like you and they can help you out. So there is a flyer that will also be given to you for their information. Thank you again. My name is Sophie, and good luck. You've got this.